Hi, Sarah. Thank you for coming to my How to Stay Young class tonight. I'd like to welcome you to our class on how to stay young for the first 100 years of your life. This class is an essential class for all of my new patients so they can understand what's going on, why, and what to do in the future. You're going to love the information we learned tonight. You can share it with your friends and family. So first of all, do we really need to know how to stay young for the first 100 years of your life? The answer is yes. 100 years ago, the average lifespan was 49 years of age. Today, the average lifespan is 77.6. By the year 2050, there's going to be over 800,000 Americans that are 100 and many that are 150 years of age. So the point is that we're living longer. That was a study shown on the Today Show in 2006 by the University of Texas. So do more people die when they're kids? Sure, that's the point. Now the chances of you living to be 80 are huge. So what has long life revealed? We've had tooth decay and other diseases like Alzheimer's set in. And now the number one problem after the age of 50 is our spinal disorders. It's also revealed the neglect of our structural system. So the most common cause of disease after the age of 50 is spinal disorders. If that's the number one cause of problems after the age of 50, you need to do something about it. So if I could tell you that someone's going to rob your house tonight at 5 o'clock, would you do something to prevent that from happening? Sure, I would. So if I could tell you that we lose our mobility at the age of 65 and we live to be 105, that is 40 years of immobility and pain. So what has improved? We now take better care of our teeth. We take many preventative steps to make sure that we don't lose our teeth. And we also are taking care of our wrinkles. Since 1997, there has been a 465% increase in the number of cosmetic procedures, or 11.9 cosmetic adjustments due to our desire to stay young. But more important than your wrinkles and your pearly white teeth is your ability to stay young and be able to move. So your lack of mobility will make you look much older than crow's feet. If your spine was on your face, the fact is you'd probably take care of it. You no longer wait to lose your teeth. You take many preventive steps to make sure that doesn't happen. And you also shouldn't wait till your back goes out to see a chiropractor. Take the gamble that you're going to live past 50 and take many preventive steps to make sure that that doesn't happen. So why is preventative care so important? There is no such thing as a spine transplant. Once your back is gone, it's gone for the rest of your life. There's no going back. You can get a new heart, you can get new kidneys, you can even get a new knee replacement, but you cannot get a new spine once it's gone. It's gone for good, and you're going to live with that pain for the rest of your life. This isn't limited to back pain. 1 in every 3 adults have neck pain. There was a study of over 10,000 adults, and 33% of those adults suffer from neck pain. You can't get a new neck. Do you plan on using your neck after the age of 50? I do. Then there was a study that 85 and 100 adults will suffer from low back pain. Do you plan on using your back after the age of 50? Of course you do. So why is everyone hurting? Because everyone's waiting until they're in pain before they go to see a chiropractor like myself. The key is preventative chiropractic care. Let's take a look at what will happen to you and your family if you just let nature take its course. And this is statistically proven that as you're born, you increase your mobility at the age of 23, you'll have about 100% mobility. And as you get older in your 50s and 60s, it drops down to about 50%, and your 60s and 70s maybe at 25%. So is it ever too late to see a chiropractor? No. There's a lot of my patients that come in have had metal rods fused into their spine due to scoliosis, or have had metal rods in one of my patients' necks, in their neck. And a lot of patients that have severe pain for many years, or migraines for 9 years, and they've all benefited from chiropractic care. It doesn't matter what age they are. It's never too late. And it's never too early. The goal of preventative chiropractic care is to increase mobility or to keep it at 80% for the rest of your life until at least maybe 70 or 80 years of age. So with everyone else, they're going to lose mobility in their 50s, 60s, and 70s. At 70 years of age, they'll be around 25% mobility. With chiropractic maintenance care and coming in once in a while, we can keep it at 80% for 30 or 40 years of your life. So while everyone else is hurting and arthritic, you'll be able to move and enjoy life. So can the scale be changed for you? Sure. You've already waited, though, until you're in pain to come see me. And that's not good because it's never too late to start. But congratulations for coming in. Let's do the right thing from now on. The first thing you must do is follow through with your entire recommendation of care. Now that you have started care and you have been used to waiting until you're in pain, you'll be kind of convinced that once you're out of pain, you'll wait till you're hurt to come back and see me again. Don't let that ever happen. Once you are feeling good, keep it that way. And don't just stop treatment and then wait till you're hurting again. To change the scale for you and your family, you need to complete all 3 phases of care: pain relief, stabilization, and then maintenance. Phase 1 is pain relief. So the cause of your pain and your disease are subluxations, and that's pinching nerves in your spine, causing irritation and pain, or disease in ways that you may never relate to back problems. The solution is the adjustment, of course, which we've discussed, and that is to relieve the pain. We must remove the pressure off the nerve from the spine. The adjustment gradually moves your spine back into alignment and away from the nerve, allowing the body to heal itself. The pain relief stage of your care is only the beginning of your care. Don't stop here. Your recommendation of care takes you through pain relief into the stabilization of pain relief in phase 2. So phase 2 is stabilization. So after the pain is gone, why would you keep coming back, Sarah? It's because you want to keep it there and maintain that corrected state. Your spine has actually been out of place for a very long time, and it thinks that that misalignment is normal. We must put it in the proper alignment, keep it there for a certain amount of time to retrain the muscles and the joints to go into the proper alignment, or else your body will naturally go to the misaligned condition without the proper care. So why does it take more time to correct your spine and to retrain your spine? Have you ever gone to the gym and lost weight by going one time? No, I wish I could. And have you ever gone to the gym and looked like Mr. and Mrs. Olympia by working out just one time? Of course not. And did you go to the orthodontist back when you had braces and they fixed your teeth with one visit to the orthodontist? No. It takes more than one visit with anything in life, and especially with chiropractic care. Stage 3 of your treatment here is maintenance. Once you have reached a stabilized condition, we will release you from active care to a maintenance care program where you'll be coming in once a month. It's a preventative healthcare plan which is simple and affordable, but also essential to changing your scale for future years. That is what you want, right? You want to be able to enjoy life in your 60s and 70s and keep moving. So you say, I knew it. This is where a lot of people say, I've heard chiropractors want you to come back the rest of your life, and they think it's crazy. Well, guess what? You're right. It is crazy. But have you ever gone to the dentist and they said your teeth look great, never come back? Did you go to the eye doctor in elementary or in 3rd grade where they checked your eyes and they said, your eyes look great, never get them checked again? Or you went to the medical doctor, did they ever say, your heart looks good, never come back and see me again? No, there's no doctor that has ever told you to not ever come back and check your body and have preventative care. In fact, no doctor would ever do that. We don't want you to come in more times than you have to. We don't need you to come in less or more, but we want you to come in for your essential plan so that you can prevent lost mobility in your future years. The purpose of your recommendations of care is to change that mobility scale for your life. We can't remove your wrinkles or make your teeth pearly white. We can help you enjoy the first 100 years of your life. Wait, this isn't just about you, it's about your family and friends. They need to have chiropractic care also. Can the scale be changed for them? Of course it can. It's never too soon to start. My 8-month-old baby, Madison, she's been adjusted 41 times as of last night. The trauma of childbirth is very excessive on the spine, and the good news is with a little preventative chiropractic care, we can prevent future problems in our children's lives when they're adults. Your family needs to come in and be evaluated for a simple, easy, and healthy plan toward preventing a life of immobility. The good news is with a little preventative care, we can eliminate much of their pain, especially when they're an adult. This will be one of the best investments you can have in their future years. They must be able to move. As a chiropractor, we have many specials going on right now. Our exam, x-rays, consultation, and report of findings on the x-rays is only $55. And I know that with chiropractic care, we've seen a lot of benefits in a lot of our patients' lives. I had a 12-year-old patient that was experiencing migraines for 9 years of his life. And doctors gave him 7 drugs every day, and nothing was preventing him from having those severe migraines. So they came in for treatment, and I told the mother, I don't know what we can do, but if we get any results, you need to tell everyone about chiropractic care, because this is something that no one else has been able to fix. After 2 adjustments on this 12-year-old boy and 9 years of suffering, he no longer has any migraines. Just 2 adjustments, and he was hurting for 9 years of his life. Can you imagine what his next 30 years would have been like? I also have a patient that came and he was about to have surgery in his spine due to severe arthritis. A neurosurgeon said, "You're needing surgery immediately after having an MRI of his lower back." He was having problems walking just 100 feet. His legs would give out, he had severe pain from his back into his legs, and he just couldn't function anymore. But before walking 100 feet, he could bend, he could move, he could enjoy life, so he decided to come see me. After just about 2 weeks of adjustments, he felt 50% better. 3 to 4 weeks after coming to see me, he said he felt better than he has ever felt in 35 years. And then just about a couple weeks ago, he came in and he said, "In December, I was in so much pain, and my life was so bad that I was at a Christmas party where they called my name to go up to the front to get a prize. As I was walking up to the front to get my prize, I started feeling that pain in my lower back where I couldn't feel my legs, or the pain was shooting into my legs. And I started to realize that I didn't know if I could make it back to my seat." And that was in December. And to imagine how I was then and how I am today, it's unbelievable the difference in my spine and how my life is. So with chiropractic care, this gentleman, he prevented having surgery, and he feels better than he has in 35 years because chiropractic works. We're allowing the body to heal itself. And because I know this is something that works, it's helped me, it's helped my family, it's helped my daughter and many of our patients. And I take this so sincerely. I'm willing to see any of your friends or family at no cost to them. They can come in, get a consultation, exam, and x-rays, and a report of findings on those x-rays at absolutely no cost. All you have to do is schedule them tonight. You have to put in an appointment and a time. I know you don't know their appointments or what their schedule's like, but just put down a tentative time for them and give us their phone number. We'll call them, and if that time doesn't work for them, we can always change it then. But that eliminates the financial strains of them coming in and taking care of their spine and getting things checked. So talk to Sarah, schedule anyone you want at absolutely no cost, because I want to help them be able to move for the rest of their life in their future years. And you and I both know that we're going to be living much longer, and we have to be able to move. Thank you for coming and enjoying this class tonight, and I'll be seeing you again at your next appointment. Just go ahead and tell Sarah about your friends and family. We'll be happy to take care of them. Thank you.